We're moving on. I'm joined now by the Vice-President of the Irish Pharmaceutical Union, Kathy Maher. Kathy, welcome to the programme.
Good evening, George.
Now, tomorrow you've got a public meeting at the Royal College of Physicians, the purpose being to inform the public on how to protect themselves and their families from infection. This principally is about the rise of the superbug, I guess, yeah?
Well, really the talk is about good bugs, bad bugs and superbugs, and how to protect yourself and your family from developing these infections and to stay healthy.
But isn't it true, Kathy, that the reason for this problem is that we as consumers want an antibiotic for everything, and the doctors as prescribers are prepared to prescribe an antibiotic for everything. So, unlike, the late 40s and 50s when antibiotics were relatively new, discovered, I think, by Alexander Fleming. When he discovered it was hailed as the great breakthrough against infection, and then we started giving it for everything.
Well, that's right. So, antibiotics were quickly recognised as miracle drugs, and the possibilities that they've given us over the past 100 years have been endless. Very early on, when patients were dying from chest and throat infections that are now treatable with antibiotics, as soon as resistance to one antibiotic emerged, a more effective antibiotic was produced. And this was before we really understand that this resistance could happen. The golden era is potentially closing because the antibiotic production has slowed in recent years. We've known that the last new antibiotic class that was produced was more than 12 years ago. So we're losing these miracle drugs that we had.
Well, explain why it's been 12 years since a new antibiotic was produced by an industry, the pharmaceutical industry, which is pretty famous for its invention.
Well, there are fewer being made because every time one was being made, the bugs became resistant, so these became these so-called superbugs. So they're harder to kill. Using antibiotics when they're not needed or not taking them exactly as prescribed gives the bacteria a chance to get used to the antibiotic and to adapt, and then the bacteria can't be killed anymore. These so-called superbugs can then go on to cause serious illness and death. And I suppose medicine and pharmacy can only go so far. There isn't the knowledge or the drug out there to kill these superbugs. Antibiotics are expensive, they take longer to develop and test, and I suppose from drug companies, if they're going to develop and test one that's going to be resistant in a short space of time, they may not get return on their investment, so they may not.
Return on investment is an interesting question because a number of companies now, their patents are running out on drugs, which means a generic drug can be provided quite cheaply. The minister is keen that we use generic drugs. But I mean, if I go to my pharmacist and I ask for, and I mean, obviously as a non-pharmacist, but I ask for Nurofen or Augmentin or some of these standard names that people know well, and the pharmacist says to me, no, I can give you the same, but it's cheaper and it's called something else. They are discovering in surveys that people aren't confident in the replacement drug. Would that be the experience of your members?
No, patients have that pharmacists are one of the most trusted healthcare professionals, and patients trust their pharmacist. So when the pharmacist does say that the generic is the very same as the proprietary brand, patients have their complete faith in pharmacy. But going back to the topic of the good bugs, the bad bugs and the superbugs, the key thing tomorrow night is to make sure that we have patients have a better understanding of when and why they need to use antibiotics and when they can simply medicate across the counter with medicines that don't need prescriptions, just really to manage their symptoms.
Well, you'd really, therefore, be quite in favour of old wives' cures, perhaps, or herbal cures, or whatever, would you?
Well, there's lots of lifestyle measures that patients can use to treat symptoms of common cold or flu, and we need to make sure the patients understand what the difference is between a common cold and the flu. So tomorrow night I'll be talking to those there and also on their webcast about the different symptoms, the fever onset, whether it's a long onset of a few days or whether it comes on very quickly, or sweating, fatigue. But then to go into the self-care treatments, yeah, absolutely, it does go back to fluid and rest. Does it does go a long way in treating the common cold.
Okay, you mentioned webcast. How are we going to be able to access the webcast?
You can go onto the RCPI website, or you can follow the Twitter feed on the hashtag RCPIPublic.
RCPI Public, and that's the hashtag, is that right?
That's the hashtag.
All right, so the RCPI website tomorrow night, if you want to go, it is 6 o'clock tomorrow night at the Royal College of Physicians, number 6. Kildare Street, Dublin, and that was Kathy Maher, Vice-President of the Irish Pharmacy Union.